The video that you are about to watch includes the beginning of the exercise and movement program of the Meeks method. This method has been designed with safety and therapeutic intent to target areas of the body where strengthening is needed most. And this program complements the use of the spinomed orthosis. The position with the hips and knees bent, feet flat, and hip distance apart, arms turned upward about midway between hips and shoulders, and cervical spine in neutral is called the decompression exercise position. And the patient is frequently advised to lie in this position for 5 to 15 minutes before beginning any other movement. It is not always necessary to support the lower arm with a folded towel, as demonstrated on the video. The folded towel underneath the lower arm would be used only if there is sufficient shoulder protraction, which would limit movement. Alternative starting positions for patients with breathing or back pain issues are demonstrated at the end of this video. Note that in severely involved patients, it may be necessary to elevate both the head of the bed and the legs at the same time. Starting this program in a pain-free position where the patient is breathing easily is an essential component to its success. It should be noted that the first exercises, which include decompression, wings of the collarbone, shoulder press, leg lengthener, and leg press, are usually performed sequentially, although all of them may not be taught to the patient at the same time. That is, there is no need to reposition the patient between the exercises. Repositioning has been shown in this video for increased clarity. In the leg press exercise, note that the therapist brings his hand to the inside of the ankle when he gives resistance. When the exercise is done bilaterally, he brings his hands underneath the heels. This is done so as not to bias movement toward hip abduction or external rotation. If genorecurvatum occurs during the leg press, place a small rolled towel under the knee to avoid knee pain. You should also note that the patient is instructed to hold an isometric exercise for only 1 to 3 seconds. I have found it best to begin with a short hold, and as the patient progresses through the program, a longer hold up to 6 seconds may be recommended. Be sure that patients are not holding their breath during isometric exercises. This program begins in the supine anatomical position, which is the position of least spinal compression. The program can then be progressed through positions of increasing compression, which would include side lying, prone, hands and knees, kneeling, standing, and finally sitting, which is the position of most spinal compression. If you begin this or any exercise program in the seated position, please be aware that you are starting it in the position of most compression and support the back as necessary.
Now we're going to see a demonstration of the basic exercise program that focuses on the strengthening of the back extensor muscles and is complementary to the use of the spinomed orthosis for osteoporosis. The patient is lying on the back with the hips and knees bent so that we relieve the pull of the leg muscles on the back. The object of this exercise is to relax the back and to lengthen through the bony structure of the back. The arms are turned up, and you'll notice here that we have the lower arms supported. Because of the protraction in the shoulders of the patient, we need to support the lower part of the arm so that she'll be able to do the first exercise. The cervical spine is in neutral regarding either flexion or extension of the spine for the head alignment. For the first exercise, the shoulder press, the therapist will place his fingers under the shoulders at the acromion process level and asks the patient to feel his fingers and then to press the shoulders into his fingers. You will notice that the shoulders descend towards the table. We hold for 2 to 3 seconds and allow the shoulders to just relax into their natural resting position. Then, to coordinate it with the breath, we ask to take a breath in, and then as the patient breathes out, he or she presses into the fingers for the shoulder press exercise. An alternate exercise to this is called the wings of the collarbone. So the therapist traces the collarbone, runs his hands along the length of the collarbone, and asks the patient to lengthen the collarbone at the same time. And you will notice as the patient lengthens the collarbone that the shoulders come down towards the table. So the wings of the collarbone lead directly into the shoulder press exercise. Now, to show the patient that she is actually triggering the motion of the back extensors, the therapist slides his hand underneath her back to palpate for the spinous process of the thoracic spine, and asks the patient to feel the pressure on the bone, and then to do the wings of the collarbone and the shoulder press, and asks the patient to feel the lift of the bone off from his fingers. So it's a press down with the shoulders and a lift up with the spinous processes in the thoracic. And then relax and repeat one more time. Now we're going to have a demonstration of the beginning of the exercise program that focuses on the strengthening of the back extensors that complements the use of the spinomed orthosis for osteoporosis. The patient is lying on her back with her hips and her knees bent. Bending the hips and the knees is important to help the back to relax. The feet are flat on the table and the arms are turned up in the anatomical position, and we have placed a support underneath her elbow and her hand because of the protraction of her shoulders. This will make it easier for her to do the exercise program. The next exercise is called the head press. The therapist will check the alignment of the head and the neck, making sure that the cervical spine is in neutral. This patient has a nice neutral cervical spine, so he will place his hand on her chin and ask her to keep her chin in place, to feel the back of her head on the table, and to press her head gently into the table. So it's press, 2, 3, and relax. Again, keeping the chin in position to take a breath in, and as you breathe out, press, 2, 3, and relax. And then the therapist is going to palpate the neck extensors to make sure that we're getting a good contraction. So once again, she's going to breathe in, and as she breathes out, press the head into the table. Press, 2, 3, and relax. During the exercise, you may notice recruitment. The chest may rise slightly, or she may even get some action in her lower back. This is absolutely natural and not to be interfered with. If the cervical spine is not in neutral and is instead in flexion, then the therapist needs to support the cervical spine with a small towel, bringing the neck into a more neutral position. And then, when the patient does the head press, she tilts the chin up slightly just before she does the head press. If, however, the cervical spine is hyperextended, then the therapist will place a folded towel underneath the head, thereby bringing the cervical spine more into a neutral position. Before the patient does the head press, she should tuck her chin very slightly and then do the head press. The next part of the exercise program focuses on the strengthening of the back extensors and complements the use of the spinomed orthosis for osteoporosis. The beginning position is called the decompression exercise position, with the hips and the knees bent. By bending the hips and the knees, we relieve the pull of the muscles of the legs on the back and allow the back to relax. The arms are turned up in the anatomical position, and you will note that we have a support underneath the elbow and the hand. This is because of the protraction of the right shoulder, so that we position the arm in a better anatomical position for the beginning of the exercise program. The next exercise is called the leg lengthener. The therapist comes down to the foot of the table and asks the patient to straighten one leg down to the table and pull the toes and the forefoot towards the knee. The next instruction is that the patient keeps the foot in that position and lengthens the leg by pulling the top of the pelvis away from the rib cage. Count 1, 2, and relax. Take a breath in and lengthen the leg again. 1, 2, and relax. And then the patient will rebend the knee and bring the foot flat on the table and straighten the other leg. And when you do the other leg, please look carefully for any compensatory movement, such as add or abduction, or external rotation of the hip. Adjust the foot by pulling the toes and forefoot up, extending the heel and lengthening the leg again from the pelvis. So it's lengthen, 1, 2, and relax. And then taking a breath in and lengthening, 1, 2, and the breath out, and relax. And then the patient rebends the knee and brings the foot back to rest flat on the table. Number of repetitions for this exercise is 2 on each side, and then that is repeated 1 or 2 times for a total of 4 to 6 leg lengtheners. Now we are going to demonstrate the beginning of the exercise program, which emphasizes the strengthening of the back extensors and complements the use of the spinomed orthosis for osteoporosis. The next exercise is called the leg press. And we teach this exercise particularly if a person has back pain or other symptoms secondary to perhaps a compression fracture or other low back pathology with the leg lengthener. So the patient extends one leg down. Adjust the position of the foot, the same as in the leg lengthener, pulling the toes and the forefoot up and the heel out. And then the patient is instructed to press the entire leg down into the table as if they're going to make an indentation in the table that looks just like their leg. Or, if the therapist tries to pick the leg up, they will be unable to pick the leg up. This exercise strengthens the quadriceps, the gluteus maximus, and the lower back extensors. It's always a 2-second hold and a release. And then we return the knee to the bent position, the foot flat on the table, and extend the other leg down. Once again adjusting, making sure that the foot is in neutral, adjusting the position of the foot, and asking the patient to press the leg straight down into the table. Press, 2, 3, and relax. Keep the second leg straight and extend the other leg down next to it. Reposition the feet, and the therapist will slide his hands underneath the heels so as not to bias movement towards abduction or external rotation. And the patient then presses both legs down into the table. Press, 2, 3, and relax. And then the patient rebends the knees one at a time, with the feet flat on the table. And this concludes the basic exercise program. With this program, we have strengthened the lower back, the mid-back, and the upper back and neck extensors. So now it's time to get the patient off the table. We ask her to roll over onto her side as much as possible, like a log, and to bring her feet carefully over the edge. As she stands, the patient should pretend she is 2 inches, or 4 to 5 centimeters taller, and she points the feet straight ahead. Now the patient is ready to balance and walk. And now we have the patient standing in the spinomed brace, and we're going to begin with some balancing exercises in the standing position, beginning with the first, which is weight shifting side to side, so the patients learn to balance on each leg. And then, after we've done a few repetitions, we go forward and back. So we balance forward and back, and this will lead into more advanced balancing exercises. After the patients have started with balancing exercises, we want them to begin a walking program with the spinomed. If the patient is unable to lie in the hook-lying position, particularly if they have a condition called spinal stenosis, you may have to position them in the 90-90 position, with the hips and the knees each at 90 degrees in order to relieve back pain. We then begin the exercise program with the shoulder press and the head press, and then take them down into the hook-lying position for progression. In cases where the patient is unable to lie completely in the supine position, it is necessary to raise the head of the bed to about 30 degrees or perhaps even more to begin the exercises program. This is particularly useful for patients with COPD or heart conditions or other conditions which make it difficult to breathe.